Part 6 of Module 6, the endocrine system. In this image, we see the pituitary gland, also called the master gland, the thyroid gland, which regulates growth and development, the parathyroids, which regulate levels of calcium and phosphate, the adrenals, that secrete adrenaline and other hormones, the pancreas, which produces the hormone insulin, and the male and female sex glands, which are the ovaries for women and testes for men. They too secrete hormones. The anatomy and physiology of the endocrine system serves multiple functions in the body. It is made up of organs and glands that produce and secrete hormones. Functions include maintaining homeostasis through hormones, growth and development, regulating levels of calcium and sugar, metabolism, sexual development, and the body's ability to reproduce. Hormones are vital for survival. They are carried in the bloodstream and deliver specific hormones to specific tissues or organs. For older adults, there are normal changes that are expected to occur. Levels of estrogen and progesterone decrease, which signal the onset of menopause in women. Testosterone levels in males usually decrease, but production does not stop. Insulin production decreases, and the body is less able to handle stress. Here are a few common complications of the endocrine system. Hormonal imbalances can impact body processes for men or women. Hypothyroidism is an underactive thyroid gland versus the opposite, which is hyperthyroidism, an overactive thyroid gland. Another complication is diabetes mellitus, diabetes for short. There are two types of diabetes, and they are appropriately named type 1 and type 2. Type 1 is diagnosed at a young age. In this type of diabetes, the pancreas does not produce any insulin, so it's noticed shortly after birth. Daily injections of insulin are required, as well as blood sugar testing and a special diet. Type 2 diabetes is the most common today, and it can occur at any age, but it's usually later in life. In type 2 diabetes, either the body does not produce enough insulin or the body fails to properly use insulin. Type 2 diabetes is more mild compared to type 1, but the popularity of this kind of diabetes is rising in the world. Careful monitoring of blood sugar is necessary. However, this form can often be controlled with diet, weight loss, and medication, either by mouth or with injections of insulin. When the blood sugar gets too high, it's called hyperglycemia. When the blood sugar gets too low, it is called hypoglycemia. If the sugar in the blood remains high for a sustained length of time, it leads to what is called diabetic ketoacidosis, a life-threatening problem. CNAs are helpful in perceiving signs of high or low blood sugars to report to the nurse. It is critical to remember who is a diabetic in your care, even visitors, how to respond to common issues in their daily lives. Always check with the nurse and refer to care plans for instructions for the residents with diabetes when you are unsure. More on diabetes. Some people are predisposed to diabetes because of risk factors such as a positive family history of the disease. Type 2 is common in the elderly, so age alone is a risk factor, as is obesity because of the increased demand for the pancreas to produce insulin. Complications that are caused by the disease are hypoglycemia, diabetic ketoacidosis, or DKA. Decreased blood flow creates circulation problems like peripheral vascular disease and coronary artery disease, and in other areas of the body, especially in the lower extremities where blood is dependent. If infection is severe, it can lead to gangrene and tissue death that may result in loss of toes, feet, or even the legs. Diabetic retinopathy is a complication of diabetes where there is damage to blood vessels in the retina of the eye that can cause blindness. Damage to vital organs like the kidneys is very serious because we need our kidneys to filter our blood. Finally, diabetic peripheral neuropathy, which is experiencing numbness, pain, or tingling of the legs, feet, or hands, can cause nerve damage and lack of sensation. We have to be very attentive to the surroundings for residents that have neuropathy because they may not feel pain or notice any injuries in those areas. Report to the nurse. Now let's look at the symptoms in depth for hyperglycemia and hypoglycemia. You will need to know when to report these symptoms to the nurse. Hypoglycemia signs could be sweaty and cool skin, hunger, nausea, vomiting, jitteriness, restlessness, shaky feeling, headaches, complaints of double vision, confusion, shallow breathing, weakness. I've seen slurred speech before. Hyperglycemia, that's high blood sugar. Their symptoms are slightly different. Excessive thirst, hunger, urination, dry skin, slow healing sores, cuts and bruises. They may fatigue easy, have unexplained weight loss, also some vision problems, tingling and numbness, and one of the symptoms that stands out is the sweet-smelling breath or sweet-smelling urine. Report those symptoms immediately. The nurse will ask for us to continue to observe for the compliance of a diabetic with their nutritional intake, report if they are not compliant, if they start to consume excess sugar. They should take sugar substitutes like Splenda if they're going to have sweets. If they're skipping meals and snacks, that's also something we need to make sure the nurse is aware of. CNAs assist the nurse in charge of monitoring residents' responses to their interventions. If something isn't helpful, we need to know. We'll also want to keep their skin clean and dry, observe for breaks in the skin, especially the feet, encourage residents to follow the exercise plan, report complaints of pain, numbness, tingling in the arms or legs, any changes, encourage residents to have proper footwear, make sure they wear cushioned socks and good fitting shoes, report changes in their mobility, their vision, if they seem nervous or anxious, and be mindful of water temperature during bathing. Residents with diabetes that have neuropathy won't be able to tell if the water's hot. So if you don't check the water, make sure it's at the proper temperature, you could potentially burn them. This concludes the material for Chapter 23. Please review the skills in the reading on guidelines for safe diabetic foot care.